Hello and good day to each of you, dear viewer and a learner. I am Judel Cherry Digal.
I am Elmi Silanias.
I am Geraldine Sagpang.
I am Juan A. Bernales.
And we are the Group 5. Right now, we're about to discuss to you the emotional or conduct disorders. Some of you heard about this one, or to those who are not, please listen attentively so we could able to meet the learning objectives or outcomes of this topic. To define the emotional conduct disorders, they listing different types and causes, symptoms, diagnosis, and treatments. Let's have first the definition. It is a group of behavioral or emotional problems which mostly experienced by childhood or adolescence. If you notice some other people or may act or behaving like this, like being antisocial, this could be a problem. People with this disorder may disregard basic social standards and rules. Try to observe someone or even in your personal matter, it really or if it matches the way you behave. Okay, let's have number 1. Difficult time following the rules. And second one is difficult time respecting of others. Third, difficult time showing their empathy. Fourth, difficulty of behaving in a socially acceptable way. Fifth one, being irresponsible. 6. Skip school or run away, delinquent behavior. So when we say delinquent behavior, so the way they neglect or being sloppy in things that surrounds them. So 7. Steal or do other things that violate the right of others. And 8. Physically harm animals or other people, such as committing assault or rape. I was not saying that if you done any of these things, you are emotionally disordered person. Aside from 6 to 8, it cannot be considered as normal. Okay, let's try to differentiate a normal person would do and an emotional disordered person. I'll take 4 parts of this observance that a normal person could done also. Difficult time following the rules, difficult time respecting of others, difficult time showing their empathy, difficulty of behaving in a social acceptable way, unless if they're doing it all the time or consecutively with the addition of 5 to 8 behaviors, they are considered emotionally disordered person. Let's have the next slide that this involves the presence of emotional states like depression and aggression over a considerable amount of time that they notably disturb and disturb learning and performance in school. These people are neglecting what the performances or activities that are done in school. So let's try to interpret the pictures that's shown above. This little girl that is shouting to his classmate or to his playmate, I think, and the picture that is shown in the middle that he's making other people in trouble, and the third one is he's not listening to the woman or a teacher or a mother to his mother. And let's try to tackle another.
So, to understand more about emotional and conduct disorders, let me discuss and explain the types and causes of emotional and conduct disorders. So, emotional and conduct disorder has three different types. And first of those is externalizing behaviors. So, from the word external or externalizing, it means that behavior that is expressed outwardly. So it includes a high level of irritating behavior that is impulsive and distracting or persistent aggression. So it is when a child or a person moves in an appropriate manner that may engage in behaviors that may harm others. Internalizing behavior refers to how a child or a person approach other by or how they express their feelings towards others, how they move, how they engage to other people around them. So there are three common problems relating to externalizing behavior. So first of those is hyperactivity. So hyperactivity means having increase in movement, how having increase how a child moves, impulsive actions, talking too much, and as well as fidgeting or constant moving. So hyperactivity from the word hyper means kalingaw lang og kanang move or kalingaw lang og kanang lihok-lihok ang isa ka bata nga wala siya dili siya ka feel og kahago, mao na ang hyperactivity. So second is aggression. So aggression, it is a forceful and hostile behavior toward other person that can result in emotional or physical harm, maybe towards their peers, their siblings, or adults. So aggression from the word aggression, so aggressive ang ilang pag-approach sa laing tao. So it may result to emotional or physical harm to others. So that is the aggression. So next is delinquency. Delinquency pertains to general thought or mean of a criminal behavior committed by a juveniles under the legal age of adulthood. In other words, it means habitually a crime. So those are the three common problems in that may relate to externalizing behavior. So next type is internalizing behavior. So what it means by internalizing behaviors. So from the word internal or internalizing, it is the behavior that are expressed inward or by means of direct problematic energy toward yourself or oneself. It is expressed by being socially withdrawn, like avoiding people or activities, and just be by themselves most of the time. So people or a child choose to be alone rather on engaging to other people around them. So example problems that include in internalizing behaviors are depression, withdrawal, anxiety. Also, it may include anorexia or bulimia, eating more or less than usual, which is common to girls, and also feeling afraid, having phobias that is related to internalizing behavior. So internalizing is some people are alone, they just prefer to be themselves rather than socializing to others. And next is the low incidence. So it occur infrequently but are quite serious. So dili na siya rare na siya nga na problem but serious siya nga problema. So this may include schizophrenia, Tourette's syndrome, and coexisting ADHD. So schizophrenia means a chronic disorder in which severe mental disorder that affects a person how he or she thinks, express emotions, apathy means apathy means lack of feeling or emotion or interest, and also it includes social withdrawal. So this ya mo socialize sa uban. Those are the schizophrenia. And next is Tourette's syndrome. So Tourette's syndrome is a condition of a person that causes tics Tics are the sudden twitches of movements or sounds that a person or a child cannot stop their body for doing these things. So, dili sila ka-control sa ilang movement. Like, for example, a person na magpilok-pilok pito ang mata, or like, they stole from other person's belongings, yet dili sila ka-control sa pagbuhat anak nga butang. So, mao to ang Tourette's syndrome. And last is the coexisting ADHD. So, ADHD is the attention deficit hyperactive disorder. So, those are the three types of emotional and conduct disorder: the internalizing behavior, the externalizing behavior, and the low incidence. Moving on to the causes of conduct disorder. The exact cause of conduct disorder is not known, but it is believed that a combination of biological, genetic, environmental, psychological, and social factors play a role in which it contribute in developing or the development of this disorder. So first is biological. Studies suggest that defects or injuries to certain areas of the brain can lead to behavior disorders. Moreover, it has been linked to particular brain regions that involve in regulating behavior, impulsive control, and emotion in which these brain regions do not work properly. So, the abnormalities or the defects or injuries sa brain can contribute in the development of emotional and conduct disorder. So, children having this disorder may have some abnormalities, just like I said, abnormalities in certain areas of the brain like the prefrontal cortex and the limbic system, which affects emotional responses that do not work properly, that contribute in the development of the disorder. So next cause is genetics. So genetics, many children and teens with conduct disorders have close family members with mental illnesses, in which it suggests that a vulnerability to conduct disorder may be partially inherited. So, some studies suggest that the conduct disorder or the emotional conduct disorder is inherited from the child close family members with mental illnesses, and it causes the development or attribute the development of the disorder. So he or she inherited it from his close family members with mental illnesses. So next is environmental issues. Factors such as dysfunctional family life, childhood abuse, traumatic experience, a family history of substance abuse, and inconsistent discipline by parents may contribute to the development of conduct disorders. So, the trauma and the abuses a child or a person experience may attribute or contribute to the development of conduct disorder, in which his behavior does not develop or affect by the abuses he experienced and by the inconsistent discipline of his parents that may affect his behavior and contribute to the development of this disorder. And next is psychological issues. Experts believe that conduct disorder can reflect problems with moral awareness and deficit in cognitive processing. So, experts believe that conduct disorders can reflect problems with moral awareness. So, a child or a person has lack of moral awareness or notably lack of guilt and remorse. So, he or she does not learn how to respond accordingly, normal response to other person, and it also includes the low IQ, poor verbal skills, and may make children more vulnerable to conduct disorders. So, children with poor verbal skills, so dili sila ka express how they feel with other person, how they feel, how they feel, and how they interact with others. So that may cause or that may attribute to the development of conduct disorder. So next is social issues. Low economic status and not being accepted by their peers to be risk factors for the development of conduct disorder. So low economic status, which means it is an issue where a child feel that she does not belong in the in the society like that, and he or she does not get what he want because they belong to the low economic status where it affects his behavior, and also not being accepted by their peers. So wala siya gi-accept sa iyang mga amigo. So it develop the conduct disorder. So it affects how the development of his or her behavior towards others. And that's all the causes of conduct emotional or conduct disorders.
After knowing the types and causes of emotional or conduct disorder, let us understand what are the symptoms that a child or someone is having because of this kind of disorder. And later on, we will also tackle about the risk factors. At some point in our development as children or teens, some might encounter behavioral changes or problems, which is normal. However, if behavioral changes or problems becomes long-lasting and it comes to the point that someone violates the rules of others or the accepted norm of behavior, then we could say there might be a problem. So children who have conduct disorder are often hard to control and unwilling to follow rules. They act impulsively, or they act without much thinking, or for example, when they do certain things without having a careful thought of what could be the result. So children who have conduct disorder act impulsively or act due to an impulse without considering the consequences or the feelings of others. In general, the symptoms of conduct disorder fall into four categories. First, the aggressive conduct. Second, the deceitful behavior. Third, the destructive behavior. And lastly, violation of rules. Let's tackle first the aggressive behavior. So, aggressive means there is force or a feeling of anger to do something. So, a child having a conduct disorder tend to act aggressively and act impulsively. So it is because they tend to think that the people around them are also aggressive or threatening toward them. So they try to intimidate or bully others, physically harm people or animals on purpose, commit rape, or comes to the point that they use weapon to harm other people. Next symptom is deceitful behavior. Deceitful behavior includes someone behaves in a dishonest manner and they try to convey other people to believe on something which is not true. So it includes lying, breaking and entering into someone's property in order to steal, and even forgery. Forgery means copying or falsely making a document which could also harm other people's rights or obligations. So for example, copying the mother's signature. Next symptom is the destructive behavior. Destructive behavior includes arson or deliberately setting fire into property and other intentional destruction of property like vandalism. So children having conduct disorder might act in this kind of behavior which is destructive, and it can harm other people and even other people's property. The violation of rules. A child who has a conduct disorder tend to go against the rules of the society or the school and act inappropriately for their age. For example, skipping school, running away from home, drug and alcohol use, and sexually behavior at a very young age. Based on studies, boys are more likely to display aggressive and destructive behavior than girls, whereas girls are prone to deceitful and rule-violating behavior. Additionally, the symptoms of conduct disorder can be rated into mild, moderate, or severe. A symptom is said to be mild if it displays little to no behavior problems in excess of those required to make the diagnosis. So it includes minor harm to others. Common issues also like lying, truancy, and staying out after dark without parental permission. So having this kind of issues, it falls into mild symptoms. Next, a symptom is said to be moderate or falls into moderate category if he or she displays numerous behavior problems. So, nagkaanam na og kadaghan or nagkaanam na og kadelikado ang gi-display nga symptoms or behavior. These conduct problems may have a mild to severe impact on others. It includes vandalism and stealing. And lastly, a symptom is said to be severe if he or she displays behavior problems in excess of those required to make the diagnosis. So, grabe na kayong ipakita nga symptoms. Like, for example, considering harm to others or committing rape, use a weapon, or breaking and entering into someone's property. So here are the factors that may increase a child's risk of developing conduct disorder. First, being male. Based on some researches, males appeared to be more prone to conduct disorder than females because of lack of emotional expression. Females tend to be more capable of handling or dealing with emotional problems than males, because males express their emotions through aggressive and impulsive behavior. Next, living in an urban environment and in poverty. One of the causes of conduct disorder is the environmental factors. Economic and social instability contributes to the development of conduct disorder because children may feel that they do not belong to a certain group or to a certain society. That is why environmental factors could also contribute to conduct disorder. Next, having a family history of conduct disorder or mental illness. Some children having a conduct disorder acquire this kind of disorder from family or through genetics. Maybe one of the family members has a background of having a conduct disorder or a mental illness. That is why it is inherited. Next, having other psychiatric disorders, parents who abuse drugs or alcohol, having a dysfunctional home environment, a history of experiencing traumatic events and being abused or neglected. If a child grows up in a dysfunctional home environment, he can acquire negativities and problems resulting to anxiety and depression. Kung dili matagaan og atensyon ng isa ka child, dili ma-address niya ang iyahang emotional problems and which could result to a more serious problem or a conduct disorder. That is why as early as possible, it must be diagnosed and treated because without successful intervention, it could result to a poor learning performance and even he can't perform appropriately in the society where he belongs.
Hello, I am here to tackle my topic on diagnosis and treatments of a child with emotional and conduct disorder. So what is diagnosis and treatments? Diagnosis is the identifying of the signs and symptoms of a child or the investigation of the problem, situation of a child. And for treatments, from its root word treat, to treat someone. So yeah, how is conduct disorder diagnosed? A mental health professional can diagnose conduct disorder in child when attempts to correct behavior problems at school and at home fail. A diagnosis is often made. So yeah, kinsa may mo diagnose sa child nga naay conduct disorder. So syempre ang mental health professional or ang physician, but anha lang idulong sa mental health profession if ang bata is fail sa home ug sa school para mohatag og advice and counseling. If dili na jud makaya sa counselor, guidance counselor sa school or sa mga parents ang pag-handle sa bata, no? So adto na siya idulong sa mental health professional. So ang mental health professional conduct an interview with the kid and check records and request that parents and teachers complete behavior surveys. So kung unsay behavior sa bata sa school ug sa home, ana mangutana ang professional ug unsa ang behavior sa bata. And yeah, psychological testing and other assessment tools may also be used para ma-evaluate ang child. So, to evaluate ang child, anan ton mahibaw-an sa professional mental health ang treatment sa bata. So, naay factors para ma-treat ang bata, no? Such as the child's age, o yung edad, o ang iyahang problema, ang sayang problema, no? Ana, i-investigate sa physician ang appropriate treatment para sa bata. So, the most common treatment, ang pinakauna is ang family therapy. So, naatay gitawag family therapy because ang parents, siblings, and other members of the family is kailangan mo attend at the time nga i-therapy na ang bata, no? Kay what if ang bata is ang problema is ang family problems ang problema, so na ang family there para mag-guide sa ang bata, no, kung sa iyang problema nga na, then para sa ma-strengthen ang relationship between parents and child, ang ilahang communication, ang ilahang closeness, like that. So second is the medication. Actually, ang conduct disorder, as I've researched, wala daw no medication for conduct disorder. But sometimes mo prescribe ang physician, matag sila og, medication like Ritalin, Disicdrine, and Cylert. But ang most frequently prescribed para sa physician sa mga batang na conduct disorder is ang Ritalin. So next is the parent training. Sa parent training naa dyan na kay sa example lang family problems ang problema sa bata, no, kanang what if ang bata is lagot na kaayo nga na, then di na ma-handle sa parents ang bata, so lagot na lang pud ang parents. So no, bawal na kay musamot ang or mulala ang situation sa bata, no, nga murag mas mudot ihang galit. And then na ang parent training, of course, kay para sa ang parent is malower sa dihang ang anger if ever mo-handle siya sa bata, kay di madyag tanan maka-handle sa mga bata nga grabe na gyud, nga na mo bitang niadto na ta sa mental health professional para mga tabang, right? And psychotherapy, individual therapy, so ang bata nang danhi ang kailangan i-train, anang bata nga nang dali ra kayo malagot, no, kailangan jud na siya i-treatment na i-train na i-treat like i-deep breath para man lang an i-positive self-talk siya, no, kay wala jud mulala iyang sakit, basi insan lang iyang nahunaon magpakamatay nga na suicidal. So yeah, ang bata here is i-train ang iyang not just physical but also emotional, no, kay mo may atuang problems here, and kailangan ang psychotherapy para maka-learn sad ang bata new skills na ang isang gingon nga sama ang gingon nga maano niya ma-control sa niya ang hiyang emotion. If ever severe na gani muna ang pinaka grabe na, no, na kinanglan i-treatment na jud og pag-ayos sa professional. Kaya ang mild lang okay pa, and then moderate to pagamay, but if severe na, yeah, kinahanglan jud og mga family therapy, medication, parent training, and psychotherapy. And of course lastly ang residential placement, kay kailangan severe na jud kayo, out of control na ang bata, kailangan na siya ibutang sa residential placement na where naa na ang mga programs nga na for the child na makatabang niya to lessen ang iyang problema unsa pa man na. And then ihang mga issues, what is the issues, kita bully siya kayo sa school nga na, no, kailangan siya attention, but nga na una na siya sa residential placement, i-awin jud siya sa mga parents, friends, or yung mga classmate, guys. What if na siya hunahunaan nga lain, no, yung maharas or mambuli pag yung kaayo, mapatay niya or something nga na munang kailangan na jud siya residential placement to keep everyone safe. This residential placement DI is a therapeutic environment where addresses substance abuse issues, sexualized behavior, or violence. So yeah, muna ang diagnosis and treatment for the child with emotional and conduct disorder. So early intervention is the key to getting the most effective treatment. The sooner your child begins therapy, the higher the chances of a successful future. So kailangan jud og importante sa parents and physician na ma-aware nila ang signs and symptoms sa batang may conduct disorder. Kay kinahanglan jud nila ang attention and atong support and sa ilahang kilid nga na. And para sa matagaan sila treatment, no? And yeah, early detection and treatment are so important for children with mental health problems. So, yeah, maura to ang topic.